So, good morning, everyone. So, I'm Lopa Patel. I'm a digital entrepreneur and I'm chair of a equality charity called Diversity UK. And if you're wondering why I'm moderating this panel on leadership, I'm really a child of the Commonwealth. My parents are from India. I was born in Kenya. I don't know if there are any Kenyans here. But, and of course, in the 70s, we came to the mothership, that's England. So I'm kind of steeped in the Commonwealth, and the success of the Commonwealth matters a lot to me. I'd like to thank Baroness Scotland for the amazing statistics she's shared with us, but because I'm a digital entrepreneur, I like to think about scale at all times. So just before I introduce the panel, I'm just going to leave some statistics with you, some facts. And I would like you all to whip out your cameras if you can. We may not have time to take questions, but please take a picture of whoever you would like to ask a question to, and we'll make sure that your question gets answered. So, Commonwealth, 56 countries across 5 continents, 2.7 billion people. We can, I think, hope 50% of those are women, and 60% of them, like us, are under the age of 29, of course. If we talk about leadership, the Commonwealth Secretariat very helpfully produces a document for facts, and it says women hold only 25% of senior leadership roles across the Commonwealth countries. If we delve a bit more into that, in the public sector, they hold 28% of senior leadership roles in the public sector, and in government they are at about 26%. So we haven't quite got to the 30% or a third yet even. But if we look at entrepreneurship, how many entrepreneurs are there in the room? Can I just have a quick show of hands? Oh gosh, yes, of course, Andy. That's great. Wonderful. Social entrepreneurs as well. So if we talk about entrepreneurship, female entrepreneurship is on the rise, with women owning 35% of SME enterprises across the Commonwealth countries. So as Baroness Scotland said, she wasn't the first and she won't be the last. In terms of entrepreneurship, of course, we hope we can encourage more of that. Coming on to my wonderful panel of speakers. To my left, we have Monica Ferrer. She's the director of the United Nations Population Fund London office. Next to her, we have Dr. Linda Yu, who is an economist and the executive chair of the Royal Commonwealth Society. And on the extreme left is Iman Martin Vignette, who is the Global Affairs Director of Bosch UK. Iman plays a pivotal role in managing relationships between Bosch and the key government and external stakeholders. So what I did was I set them only 3 questions. You know, it's what I'm interested in learning, so I hope you can agree with me. And the 3 questions were firstly about resilience. We hear that a lot as women, don't we? You need to be resilient. You need to, my mother used to say to me, well, you're going to have to work twice as hard to achieve half as much. You've got to, if you get knocked down, get up again. You have to be resilient. But what does it mean for you? Monica, if I can start with you.
Thank you so much. I have to say that when I just heard your reflection on resilience, it makes me think that more than being, we have to be resilient, but we also are very tired, right? If we have to work twice as hard as men to get the same results, I think we are all exhausted, and I think that's a good way to start. So I'm going to start by saying that I work for the United Nations Population Fund, which is led by a woman. And that's already inspiring, I have to admit. So for us, resilience means development, and it means social transformation. And why? So if you really want to deliver a world with more dignity for all, with prosperity, with peace, what we heard, what we really need to do is we need to tackle and we need to unbreak gender inequality, racism, and all forms of discrimination that come from one of your identities. If we don't do that, each time a crisis hits, each time a difficulty hits you, you will start from scratch. So in order to build resilience, you really need to put transformation as one of your key focal points, one of your key goals. And of course, that for us, this means a lot, and I just have the data here. This means for us, of course, investing in healthcare. We are the Sexual Reproductive Health Agency of the UN, so of course you will never reach women's empowerment, you will never remove all the obstacles that prevent women from accessing their rights and choices if you don't invest in health. Having said this, when it comes to innovation, just because it's one of the key themes of the summit, how can it be that only 1% of the global expenditure on research and development funding goes to women-centric solutions beyond cancer, and even less to SRHR? We've heard the cost of gender-based violence, we heard the cost of discrimination. So if you don't dismantle this, not only you will never be able to prepare a society to be resilient, but you will also not be able to tap into women's potential. And I think I would like to start with these two big questions: the cost of discrimination and the need to invest in health in order to build a resilient society.
That's a brilliant start. I don't know if people know this, but healthcare, R&D investment into women's health is atrociously bad. I can see Geeta Nargund there. She will tell us a little bit more about that later on. But we might be 50% of the global population, we might be 50% of the Commonwealth population, but the amount of money that's invested into research for women's health issues is really atrociously bad.
1%.
So, yes.
It's low.
Let me come on to you, Linda. What does resilience mean for you?
Well, firstly, thanks. Is that working? Sorry, okay. So thanks very much for. So this is an example of why how women support each other. Can you actually hear me from there? Actually, I'm pretty loud. My day job is that I'm an economics professor. I'm used to trying to shout to the end of the room to prevent people from falling asleep. So you should be able to hear me. But so I think for me, resilience. I think probably two things. So the first thing about resilience, and I think it echoes both of what you've already said, which is, okay, I'll give you an example. I serve on corporate boards, and there's an American executive. Every time something hasn't gone well in the business, something's gone wrong, and there's a massive challenge, he goes, you know what? This is a massive opportunity. The rest of us are thinking like, well, that was a big failure. However, if every failure is an opportunity, to me that's resilience. That's the mindset. And that, to me, is one of the things that, no matter how tired we are, I think it's just something to bear in mind. And then the second point I was going to make is thinking about resilient leadership. There is a joke in Brussels, which I've been told. I don't know who made it, but I think it's quite telling, which is, if you're not at the table, you're on the menu. So, of course, I was at an event with the former Greek finance minister who said to me, sometimes you're at the table and still on the menu. So we hear a lot about pulling up a seat to be at the table. And I think that's the trait of resilience, is stubbornness, it's persistence. So I chair a charity which has branches and a network in over 60 countries of the Commonwealth, and what we call Friends of the Commonwealth Countries. And sometimes you just have to be very persistent. You just have to keep going. You need to be at the table. And if there's not a chair, we have a lot of young, we're a charity that works with young people across the Commonwealth. They said this, and I'm going to steal it, which is, if you don't have a chair at the table, bring your own chair. They'll make room for you if you squeeze in. You just have to keep going. So to me, those are the ideas of resilience. And, so on some days when I'm thinking, I do this as a volunteer, as chair, I kind of think, you just have to be persistent, because at the end of the day, the leadership is for a purpose, and the purpose is to positively impact lives. So if you remember why you're doing it, you'll just get up and then you'll do it. And then just finally, role models, like Baroness Scotland. Role models make a massive difference. I'm an economist, and one of the things that I do from time to time is on social media we have a hashtag, what an economist looks like, because people don't think economists look like me. So just, things which I think we're familiar with, but just remind yourself, you're a role model, and what you do will make a difference. So if you're tired, actually if you're tired, sitting on a chair is great. Don't stand in a corner, bring a chair to the table. And I think to me that's the essence of leadership. Fail, but get up, be persistent, and I guess carry a chair. I'm not sure how the last one works.
Persistence and bring your own chair. That's great. Iman, you must have lots of chairs. You're at lots of tables.
Absolutely.
What does resilience mean to you?
First of all, I would like to thank Rowan Scotland for what you said. You were inspiring, and seriously, if I was in another crowd, I would cry. It was the first time I hear that. I'm an engineer, and I never actually deal with females. I'm actually one of the few females in the edge of engineering, and I can say we're not there yet. There are lots of things needs to be done, but also resilience needs to be defined in the way how females towards females are actually working and functioning. And I can tell you that females shouldn't see other females as enemies. So they should see them as allies to get forward, like Warren Scotland now did for all of us. And I think in the way resilience is, we cannot achieve resilience if we don't have world resilience. And I saw this in lots of areas. When we talk about sustainability and peace worldwide, we can only achieve this if we achieve the fairness and justice across all of the world, that we all have the right to be educated, the right to live, and the right to do whatever we like, whatever color we are, wherever who we are, and wherever in which privilege we are born or not born in. And I think this is defined for me the resilience. And women like you all here in the room working together define the total resilience. My resilience itself in the company to go forward, etc., it will not be complete if I don't have sisters like you to keep me forward, keep me floating in the sea to achieve the next harbor. So please let us work together and let's see each other all as a puzzles to be put together to complete the whole picture. So thank you, Baroness Scotland.
Thank you for that. It reminds me of that wonderful quote from Madeleine Albright, there's a special place in hell for women who don't help other women. But you've ladies, you've kind of stolen my my third question. So I'm going to come back to my second question, which is about wealth. The wealth, it's in the title, Commonwealth. And let's talk about access to wealth for women. We know, for example, that women are grossly underfunded. What are your thoughts on that, Monica? Wealth. How do we make women wealthier?
I'm going to go back to my core business because for us it's very clear there's no wealth without health, and I think that should be one of the, if I may be there to say, this should be one of the takeaways. And for women that's critical, but because of what we were talking about, still 3/4 of all clinical trials fail to include women. So women still feel they are on a waiting list. Also, we also know that investing in women's health can unlock over $1 trillion in annual economic growth. So how can we ignore this? Can we really, when it comes to wealth, can we really ignore this huge potential that's there ready to be unleashed? And of course that this means that we need to secure women access to family planning, access to a broad range of sexual reproductive health and rights information, services, and quality products. Because from our perspective, and this is what we are tirelessly advocating, this is what really allows us to unleash a woman's potential and secure her full participation in the public space, be it economic, be it political, and I have some experience on that, but Baroness Scotland has mentioned the cost of discrimination, the cost of violence, that also being estimated. So we cannot ignore, we cannot say that we don't know that investing in health, it's not only the right thing to do, it's also a very smart investment to do. And I think this should be always brought to the conversation. We know that by securing access to health and to a broad set of services, we can promote gender equality, we can make sure girls can stay in school, and of course this is very much connected with key challenges like ending female genital mutilation, ending child marriage, but also this drives economic growth and builds resilience. Also against climate change, we shouldn't ignore this huge challenge that we have in front of us. So when I was in Parliament, I was a parliamentarian in one of my previous lives. One of the decisions we took was asking companies how many women they have on boards, and why? Because we wanted really to show that if companies don't care for women, women should take that into consideration when they do their purchase decisions. And we know that women take about 70 to 80% of the main purchase decisions in a household. Can you imagine the huge economic potential that's there too? Developers, marketers understand that if they cater to women's needs and women's aspirations, there's also a huge market that opens to them. So linking all these aspects, but of course, if you cannot control your health, if you cannot control what happens to your body, your possibility to engage in the market, in the public space, is always very limited.
That's excellent. Linda, let me come to you, because we're talking about women's wealth, but let's talk a little bit about funding for women, if we can. We know, I mean, I don't know if the audience knows, but for example, women generally attract less than 2% of venture capital funding if they are looking to set up a business. Similarly, there's a lot of unbanked women who have no access to bank accounts or credit cards. And yet we also know, for example, that microfinance companies love to lend to women because they know they're going to get their money back. What are your thoughts on that from an economic perspective?
Yeah, really great points. I think, so to increase women's wealth and income probably requires two things: systemic change and social change. So I want to start with the evidence, because that's usually what works in terms of making systemic change. And you've mentioned some of the evidence, actually both of you. But I've always found that just because, and this is probably from my years of being at a university, just because somebody hears something, it doesn't mean they've listened. So I think sorry, it's not a comment on my students. But I think my point is, so I'll give you a bit more evidence. So if you look across countries that receive income support, households that receive income support, if it's a female-headed household and you give them income support to that household, then the women spend it on education and food, including for their children. If you give it to a male-headed household, the evidence says they spend it on alcohol and tobacco. So the marginal spend is probably slightly better for female-headed households. So I think it's that kind of evidence, in addition to all the things that we just have to keep reiterating, which is, why would you not support, in terms of funding for VCs or financial inclusion, essentially half the world's population? It's in your own self-interest to do it, because women are your customers, also because financial inclusion generally for banks means more customers. So there's a lot of evidence that I think we find pretty self-evident. It doesn't mean that we don't need to keep repeating it. And then I think then you need the systemic change to make it, discrimination is just not okay. We know there's unconscious bias. We know that there's discrimination. We know there's misogyny, but it's not okay. So I think different countries need to find ways of creating that systemic legal regulatory structure to make it not okay. It's going to differ from country to country. And then finally, I think it's social change. So the World Commonwealth Society, we work a lot with young people. We're the secretariat to a group called the Commonwealth Youth Gender Equality Network. They're the UN-recognized voice for gender equality led by youth. A lot of what they do is social change. It's about making things okay. So, and highlighting when it's not okay. And social change is hard, but social change is about buy-in from all parts of society. It needs to be organic and from the grassroots. So to me, those are the kinds of things we'll need to increase women's wealth.
Thank you. I am under the cosh slightly for time. I know we've got lots of amazing panels to listen to. So Iman, I'm going to ask you actually not about wealth, but about your tips for leadership. You're an amazing leader. How do we become more like you?
Thank you. I'm very flattered. I think leadership is really the way how we see things, and it's also a style, so everyone has a different style. I want also to say is that female tick differently, and you know the female also usually they are very hardworking species, I would say, and they really sometimes neglect the networking aspects of it. So we work, and we think that hardworking will allow us also to play hard, but it's not the case. Networking is very, very essential, and if we compare the two species, and I'm saying female and male, you will find, and I'm talking about my corporate experience, you will find our male colleagues, they have 50% networking and 50% work, where the female from the team I have, you will have 80 to 90% they're really working, and they don't have time, of course, to network, because they have to go home and look after the children or whatever responsibilities they have. So we need to balance this. Networking is essential. Today's event is very essential from the leadership perspective. The second one is be confident. I saw it really in a different aspects of, for example, venture capitals and startups, that you will see a female, they're less advantaged. Either if you are beautiful, unfortunately when you come to the room, they will title you that you are in your position because you're looking. And if you are not good looking in their perspective, they will also think that probably you are not good enough for the position. So these are the kind of things, the unconscious bias. And by the way, some say it's not true. It's true, because unfortunately I can see that sometimes without like non-verbal communication, I can see it. What can be done in improving our leadership is to have role models, and actually to have more partnering rather than role models, to people who actually you can trust, and you can share with them experiences and also ask for advice. That was for me a tremendous really help for my leadership.
Thank you. Ladies and gentlemen, I'm going to have to close there, if that's all right. Please join me in thanking my absolutely fabulous
Thank you so much. Hi everybody. It's an absolute pleasure for me to be moderating this next fireside chat on the Commonwealth Health Agenda. To introduce myself, I'm Kim Rowell. I'm Managing Editor of News Production at ITN. I'm a trustee and a board member for UN Women UK. Alongside me today, it's my pleasure to introduce Professor Geeta Nargund. You are a Senior Consultant Gynaecologist and Lead Consultant for Reproductive Medicine Services at St George's University Hospitals, NHS Foundation Trust in London, and also the wonderful Hinduja-Chhabria, Managing Trustee of the Mukul Madhav Foundation, which is a charitable organisation dedicated to advancing healthcare, education and social welfare in India. Thank you both so much. And before we get into the questions, I wanted to set the scene a little bit with a couple of key stats on women's health within the Commonwealth community, and these come from the World Health Organization. So, maternal mortality rates. Sub-Saharan Africa accounts for 66% of global maternal deaths. Gender-based violence. Approximately 30% of women in Commonwealth countries experience gender-based violence in their lifetime. Childhood malnutrition. In Commonwealth countries, 40% of children under 5 suffer from stunting due to chronic malnutrition. Child and adolescent health. 36% of girls in low-income Commonwealth countries are married before they're 18, leading to associated health risks during pregnancy and childbirth. Now that makes for really bleak reading, I am aware, but I have two brilliant women here who have dedicated their work to combating several of these issues. Firstly, Ritu, if I could come to you, and if you could tell me more about the work that you do with the Mukul Madhav Foundation in India, please.
Thank you, Kim. Nice to meet you, Doctor. Thank you for this opportunity. I am, my foundation is now 26 years old. We're working in India, but the last 4 years we've been working in UK as well, registered here as well. We're working in 17 UN Sustainable Development Goals. All 17 are not as intense as health and education. We are working towards upgrading and uplifting of rural health women and child nutrition. We're trying to see how we can make a difference in the spectrum of women, as it's very clear that women are the backbone to any community, any family, decision makers, and we are basically looking at health improvement in these spectrums, so that we don't have the rush going into urban. So making sure that primary health centers are very well defined, training alongside with the local authorities, with ASHA, A&M nurses. We're ensuring that we're taking awareness campaigns and programs, working alongside with the authorities, but also being very resilient about things that are not happening and pushing our way forward. We've done so with a program with cerebral palsy, where children were not being addressed appropriately, were not registered, were not getting the care that was to be given. So that is one of our pet projects, working with that. You just spoke about children having various different disabilities. That is again one more big program that we take on. But more or less what we are aiming at is to work alongside the local government, making sure that awareness from the top central government to state level, percolating down into rural spaces, is made very loud and clear.
We'll come back to how you work really effectively with those governments and institutions. But firstly, Professor Nargund, lovely to meet you. And your work is very much centred around fertility issues and services. It'd be great to hear a bit more about what you do.
Thank you. I'm honoured and humbled to be here with all the sisters and brothers. My work is about women's health and women's empowerment. I come from a small rural town in India, and here as regards to fertility, I'm head of reproductive medicine at St. George's Hospital for nearly 30 years, and I'm a great believer in innovation. To me, every morning we wake up and think, what can we innovate? Without that, we can't change the world. So the key ones are clearly, as regards to fertility, I realized quite earlier on in my career as a junior doctor that fertility treatment causes huge burden to women, treatment burden with side effects and complications, which women don't have to suffer. So I started innovating methods where women can have less drugs or no drugs and have equal success rates and avoid treatment burden and reduce complications and success rates and costs. Now that was the innovation. And then of course affordable fertility treatment, because we have today over 200 million individuals around the world with fertility problems. And so we, along with my scientist colleagues in Belgium and the US, we invented a method called the Simplified Culture System back in 2013, which is to bring fertility care to Africa and low-resource countries. So that made a huge difference to do that. And overall, then through my charity work, I founded a charity called Create Health Foundation in the UK, which not only produces reports about women's health and economics, but also helps with the research. And I'm the vice chair of the Red Cross, where we work on that. So overall, it is about changing women's health, because as all of you are talking, it is economy stupid. So really, it's not just for election, it's for day to day. So now we have started producing women's health economic reports, and just showing that that is the way to make a difference to women's health and women's wealth.
Thank you for that. And taking up the economics point, Ritu, if we come back to you, because one of the big ways that you've been successful is working really closely with private organisations and governments to have this really collaborative and cultivating a relationship that is actually empowering the community. Can you talk to us more about how you go about that and what the journey has been like?
Well, the journey hasn't been as smooth as I had thought, but like I said, I have been pushing, pulling. working along with local communities is very important, but picking the right people in the community, like the district health officer, the civil surgeons, being able to speak to the group of women in various different primary health centers, is of course in the rural spaces that I'm talking about, but also finding the right people in central government as well as state level has helped me and directed me. It's not necessary that they've been the only influence on the work that we've been doing. Along with them, I've been working with medical colleges, I've been speaking to gynecologists, I've been speaking to women overall, trying those who are influencing the work that I'm doing, as well as learning a lot. I mean, it's been a journey of learning, a journey of picking up where someone has left a trace of how to go about it. They've given up and picking up on those things. So I have had many innovative ways of working through the systems. I have been pushed back many a times, but I haven't sat back. I have always pushed my way. But it's always about making friends, making truce, and seeing how we can move forward.
That's such a wonderful process. Also, if you come back to you, Professor Nargund, so it's only 58% of women of reproductive age that are having their needs met within the Commonwealth setting, according to the World Health Organization. Do you find that it's still a bit of a taboo subject area, and is that a hurdle that you have to overcome in the first instance, or is it changing, is it evolving?
It's changing, but the progress is too slow. Yes, when it comes to women's health, including in our own country here, women's health issues are often stigmatized, overlooked, under-researched. Even in the UK, less than 2.5% of public funding goes towards reproductive health research, when 1 in 3 women suffer from reproductive health problems during the war. I just thought I would give some data, because then we will know how shocking it is, what we are saying. So yes, progress has been made, but if you look at, in the sense that global rate of unintended pregnancies has dropped by 20%, and number of women accessing contraception has doubled over the last 30 years, and 162 countries have adopted laws against domestic violence. But listen to this. You mentioned about maternal deaths, and which is huge across the world, but even in the UK, when you're looking at maternal deaths, if you're a black woman, you're 4 times more likely to die during pregnancy or in the first year after delivery compared to white women. And if you're an Asian woman, you're twice likely to die compared to a white woman. If we look at the global data, yes, maternal deaths have come down by around 34% since 2000, but still it's huge. Around 500,000 girls give birth aged 10 to 14. Around 12.8 million girls aged between 15 to 19 give birth every year. We have 200 million people with fertility problems, and it always is women's problem. And when we started this charity and work in Africa, and I can tell you, the stigmatization that I heard one story from in Tanzania, that if a woman is childless, even if it's a man's fault, because 50% of fertility problems are due to male factor, when she dies, if she dies childless, many people didn't want to touch her body, and she wasn't allowed to be buried near other places. So that stigma continues in death as well. So much to be done, and the investment, we just published, only just last week in the House of Lords, we actually published Women's Health Economics Report in the UK. If you invest £1 extra, you get £11 back into our economy. And if you look at the global one, if you look at the amount of money we can get back, it's in trillions. So I think what we are addressing here about women's health is throughout a woman's life course. Okay, reproductive health and reproductive rights are fundamentals of global economy and global development. So we are looking at from puberty to menstruation to menopause to postmenopause, there is still lack of access to contraception, there is still lack of access to abortion, no fertility care, maternal deaths, and menopause, of course. In many parts of the world, you can't even talk about it. So we have a lot to do together. That's why we are actually united in this, because women's health is fundamental to global economy and development.
Thank you for sharing that. It's quite devastating figures, but I appreciate you sharing it with everybody. Ritu, if we come back to you, same kind of question really. When it comes to cultural barriers or the stigma around some of the work you're doing within healthcare, education, and social welfare, do you have the same kind of issues? What are the considerations and the factors that come into play?
Absolutely. Taking on from Dr. Geeta, we have faced a challenge since 2020. So pre-COVID was when we came upon the stigma against, so there was a stigma, a taboo, whatever it may be called, with menstruation. So 5 to 7 days of menstruation is when women were actually thrown out of the house, are being thrown out in Nepal, in India. We're working primarily in Maharashtra. So in the state of Maharashtra, we noticed that in this tribal Naxalite area, we had lots of health issues. We had lots of young deaths. And this was all because they were all sent out of their homes into, rural spaces, scorpions, snake bites, etc. To cut the story short, we took on the challenge to make period-positive holiday homes, as I called it, because for those 5 to 7 days, they could go and rest. So no cooking, no cleaning, no washing, no nothing, just concentrate on yourself and your health. So we created these homes, again, working with the men in the community. Very difficult, but we have changed their mindsets. We started with one period-positive home. We've got 24 villages, stroke hamlets, that have these period-positive homes. Being a simple home with 8 beds, toilets, showers, kitchenettes, so that these women would live with dignity for that 1 week. And also we created something which is vocational training. So we've got sewing machines, we've got trainers who are there to train them to make their cloth napkins, because that's what they're used to. So making their cloth napkins, contributing to it by putting 1 rupee per cloth napkin, that sustains the whole system. And this is now 4 years on, 24 of them are there. This was where we were able to work with men who said, let us help you build it, because we want our women to be safe. And this was the first time that we had men actually involved, whether it was a brother, a father, anybody came forward, and they call it Ramadan, which means that they gave their time to be building this and to make a difference. And we've got a safe haven for women now, and dignity for women, which I think has been a great move in this health spectrum. But also, like you were talking about various different statistics and everything, I think it's all about working hand in hand, but getting the men in the communities on your side, and then things seem to work a little faster in our countries. I think that's how it works.
It's impressive the impact that you can have making these incremental changes on a societal level. But I wanted to ask you both, are there any innovations in healthcare technology that is changing or influencing the way that you work?
Yeah, I think you're quite right. I mean, we have to be a bit careful about this so-called femtech, because a lot of it could be just not peer-reviewed, because it's extremely important when it comes to healthcare. It's important for everything else that they are peer-reviewed papers, and they are peer-reviewed scientific papers before you apply it to humans. Okay, because otherwise it would be wrong just to get investment for that. So I would say there are certainly some platforms for education, because I greatly believe that education transforms that I would agree. And as regards to care, because we need to invest in education, we need to invest in care. There are some that are making it affordable through digital technology, as well as through like ultrasound technology. So, and also, I suppose we are looking at more investing in gender equality, aren't we? So from that perspective, I would agree with our previous session that we must invest in women and women entrepreneurs, because they are bringing that to the board to try and get more. So certainly education, care, and equality platforms are there. Thank you.
Thank you. And Ritu, is it the same kind of situation for you as
Well,
the
I think
influence what you're
technology
doing?
has really helped me in the space of bringing urban, rural, urban together in the space that I work. Also upgrading and uplifting hospitals with medical equipment, so new technology, new equipment, all coming into place. Sorry. So bringing technology, medical equipment, upgrading, uplifting hospitals, especially government and civil hospitals with these equipments, and also during the pandemic, having the technology of Zoom, we could continue education, we could bring in therapies, physiotherapies for our cerebral palsy children, we could connect better. And that's the way that I think technology for me in the last 4 years has been more in the way that I work, especially Zoom, because I spend a lot of time in England now. For me to work with a local village head or communicate, I can see them. I can do FaceTiming and I can do all these things. I mean, I'm talking about the basic technology that has made a huge difference in rural spaces.
Thank you. I know that we're constrained by time, but I just want you all to join me in thanking. Please. Does that work? Yeah. There we go. Please join me in thanking Professor Geeta Nargund and Rita Hinduja-Chhabria. Thank you both so much.